Welcome to the Western Cape Teachers Forum, a platform where we educate, empower, and excel. Now, the country has in recent days seen a record number of daily infections as the new Delta variant is spreading like wildfire throughout the country. And we have also seen thousands of teachers and education sector workers being vaccinated at various sites around the province under the auspices of the Western Cape Education Department. There are, however, a concerning number of teachers and individuals alike who have opted not to go for the jabs. And it is reported that in Gauteng, more than 10,000 teachers and education sector workers have opted not to go for the jabs. For us, however, who have taken the vaccination, this is not the time to lower our guards and become complacent.
Our best shot. Yes, you've been vaccinated, but you still need to. Wear a mask. Perform hand hygiene. Practice social distancing. And avoid large gatherings. Did you know your body needs around 60 days to build immunity after receiving all the required vaccine doses? No vaccine can protect you 100%. The COVID-19 vaccine saves you from getting seriously ill or dying from the disease. But there is still a chance you may get a mild or asymptomatic infection, unvaccinated versus vaccinated. Don't relax your behavior. Don't put others at risk. Protect yourself and others.
Now, to help us demystify some of these concerns that may exist out there, we are joined tonight by Dr. Tabie Greyling, who is an infectious disease physician at NETCARE Christiaan Barnard Memorial Hospital. Dr. Greyling, good evening and welcome to the Western Cape Teachers Forum.
Good evening, Lee. Thanks for having me.
Well, the pleasure is all mine. Doc, now let's get straight into this conversation. Now, medical sciences have, over time, they've been able to control several diseases in the form of hepatitis A and B, rotavirus, chickenpox, measles, polio, the list goes on. Can we include COVID-19 to this list?
I would surely hope that we can one day say, we've eradicated this disease with vaccines. At this stage, the vaccines are great at preventing death and hospitalizations and serious illness. At this moment, that it can't prevent disease entirely. So you might still get mild disease or asymptomatic disease, but what it does, it keeps you out of hospital and keeps you out of dying. And that's exactly what we want, especially from a healthcare worker side. We want to keep people out of hospital.
Yeah, and I mean, you guys are in the business of saving lives, and that is your core duty.
Yeah.
Now, let's talk about the safety thing. I've been informed that, in previous cases, the vaccines take a large number of years to develop. And in the case of COVID-19, these vaccines were developed in rather short space of time. Now, any comment to speak on that one?
Yeah, I think that's a very, very common question. And it's a good question to ask. I think, what we encourage is critical thinking. Think about it, but don't be paranoid about things. So just put in context, for example, the new Pfizer vaccine, the Moderna vaccine are mRNA vaccines. That technology has been coming for decades. So it didn't just arise within 1 year. So the technology was there. Basically, all we needed was the sequence of the protein we want the body to recognize, and then put that inside a vaccine. So that's why it took a little bit. It wasn't as long as years. And also the viral vector vaccines, they've been, which is the AstraZeneca and the Johnson & Johnson vaccine specifically, those vaccines have been tried for flu, Zika virus for many years. And just remember that this COVID, the first SARS-CoV-1, not COVID-2, the first SARS, happened, 2000 and 2003, there was the initial one. So, it's been around for a while, the coronaviruses. So not all this data and everything what happened was just in 1 or 2 years. There has been a lot of preliminary work in the previous 2 decades. But what we can expect, as technology has developed over the years, things will go quicker. If you want to get to a different province, you can walk, you can ride a bike, or you can fly. It depends on what technology you prefer. Same with vaccines. Things will get quicker and better as time goes along.
Yeah, I mean, for a layman like myself, somebody mentioned earlier that the Johnson & Johnson shot, that's a single shot or a single dose versus your Pfizer, that is a two-stage one. Excuse me for the lack of or not
No,
guessing
perfect.
it. But I mean, what are the sort of, in terms of comparing the various vaccines in terms of its efficacy? Could you share some some thoughts on that?
Yeah, so the mRNA vaccines are really great. It's new technologies, great vaccines. The data on them, the nice thing is we've got data coming through now for about 6 months now, because it's been used in the United States and especially in Israel, predominantly the Pfizer vaccine, the mRNA vaccine. So a lot of data is coming through now looking at 6-month safety, efficacy. And what's coming through from Israel, for example, is that, the cases, as the wave of new variants come along, your cases increase, but the hospitalizations and death has not gone up, which is different from the first wave. So we know from real world data that those vaccines are very, very effective. The Johnson & Johnson obviously has been used in the United States and South Africa. The data that was recently published about a week ago, update on especially the Delta variant, which is now taking over in South Africa, very much more contagious, that the Johnson & Johnson is actually very, very, it's got a great vaccine efficacy against it. It works very, very well, even better than against the South African variant, which is really very good news for all of us, especially having had the Johnson & Johnson vaccine and for teachers getting it now. So, they work really well. The data, we've got more data for the Pfizer, so that's looking, but it doesn't mean that isn't the same for the Johnson & Johnson. We just need a bit of more time to get it. But they seem to work very well. What we do know for the Johnson & Johnson vaccine, about 4 weeks, 1 month after you've had this vaccine, from the trial data and also from the data from doctors that had it, the first 500,000, is no one was admitted with severe disease and nobody died of severe illness in the initial trials, especially 1 month, after the vaccine. After 2 weeks already, you've got about a 93% chance of not ending up in hospital and having severe disease. So we know that they actually do work from data. And these studies were done across the world, different populations in South Africa, and also people with compromised immune systems, for example, people living with HIV. So that's great data, local data.
Yeah. So, and I mean, that was going to be another question of mine. Let's say I'm vaccinated today, the 7th of July. Does that mean that between now and 14 days from now, I'm still sort of, would it mean that I'm not best protected by the vaccine as yet?
Yeah, I would say you're still vulnerable in the first 4 weeks. The data usually looking after a month is when you're going to be the best, chance. And that immunity actually increases over time. We've now got data from this Johnson & Johnson vaccine that immunity actually increases. They've got data now for 8 months. And they found that at 8 months data, the antibody levels and your cellular response, the different part of the immune system, actually has increased over time. So the first 2 weeks you're still vulnerable, but after a month you should be kind of set and safe.
That's interesting. I mean, so how would you respond to a comment like this? The vaccines are only, well, I almost said valid, but they're only effective for a period of 9 months. Thereafter, they're useless.
Well, you can't actually make the statement because you don't have that data yet. We know they work for at least 8 months. Our antibody levels, we've got great data for 6 to 8 months, and T-cell response. But looking at memories, how the immune system work, people always focus on just the antibodies. It's like looking at a tree and just looking at one branch. It's one part of the immune system, which is incredibly complex, even outside my scope of practice. So, but the other parts of this tree, the other parts of the immune system, they've got memory cells that can last up to 2 years. So, we really don't know yet. We've got data for 8 months, so nobody can really say beyond that. But looking and comparing to other vaccines can be up to 2 years.
Yeah. All right. Now, Doc, in terms of side effects, I had my jab at last week Wednesday, and I've not had any side effects except a little sensitive spot at the area of where the needle went in. And some people have complained about headaches and sore muscles and extreme fatigue. Now, is it true that if you do experience side effects or symptoms, that your immune system is at its best?
No, not necessarily. What we did find that people that had COVID before, they get more side effects because the immune system is already exposed to it. So this injection is like a second exposure and you respond more rapidly. We find also there's an age kind of discrepancy. Those above 60 don't hardly get any symptoms. So those below 60 can get severe symptoms. But it doesn't mean your immune system is not responding. It doesn't mean it's not working. It's just your body reacts differently to it. And that's what we find everybody is kind of different in some way, and people will respond differently. But the fact that you don't have anything doesn't mean that it's not working.
All right, and in your experience, what is the extreme in terms of side effects that you've seen and observed?
Well, I mean, we've had the biggest data we've had is for in South Africa is for the 500,000 kind of healthcare workers, more or less, give or take, that had this vaccine. The biggest risk for people they've always quoted and they've read about is the blood clots. And I think that's something that's worth addressing, because that's it's rare. The chance of getting a blood clot in a vaccine like this is probably about 1 in 110,000. So it's a very rare side effect. To put into context, your risk of getting an allergic reaction to penicillin is 1 in 10,000. So your risk of getting side effects must always be put into context. 1 in 100,000. So, and that was seen in a specific, usually, younger woman, so there's a risk of that, but that's probably the worst. And they've had 5 cases out of the 500,000, keeping it more or less 1 in 100,000 chance of getting that. The rest of the side effects, it's been headache, it's been fevers, it's body pains. I myself had a decent fever of about 39.5 degrees when I had the vaccine, but I had COVID 3 months prior to that.
Okay.
So that's also why I had an extreme response. But we've had, I think, out of the 12, from the data from about the initial data from 12.5 million people, only 1 person had an allergic reaction to the Johnson & Johnson vaccine. So that's exceedingly rare. The big thing that you want to keep in mind, the worst thing is a very rare type of blood clot. And that's, your chances is very, very small of that.
All right. At this stage, I just want to greet the followers and those who have joined us on the live streams. Good evening to everybody. I'm not going to mention all of you. There's a number of you, but just to flag a few, there's Sean Rick that says he's tuning in from the Strand. Then Colisa is tuning in from Wynberg, Cape Town. There's Mr. Robert Poison. Is it Poison? From Worcester, all the way up in the Boland area. And then Tanya is tuning in from Cape Town. Welcome. Ranel is coming from East River. Farida's Athlone. And there's a number of us that have joined in tonight. And thank you very much for the support. Now, and then just Tanya van Wyk is saying most of our staff complement plus minus 35 were vaccinated last week. Only about 5 had side effects. Now, there's somebody had mentioned something here, and I just want to flag this one here. Terence Smith Doyle says, I'm disappointed. I recently recovered from COVID-19, hence I cannot be vaccinated. I've been told I have to be vaccinated with the general population. Such a pity as I can July. And yeah, so Doc, there's one. You wanna respond to that one quickly?
Yeah, so basically we say about 30 days, 1 month after you've had COVID, you can have a vaccine. It's just we don't want to attribute any side effect you get from the vaccine, miss it with a possible side effect from COVID itself or a long COVID syndrome, and then wrongly address it. It also gives your body's immune system just time to recover a little bit after a major infection to respond properly to the vaccine. So you can definitely get a vaccine. You just have to wait about 30 days is the recommended time between having COVID and having the vaccine.
Now, what would be the safety risks here? I am knowingly going for my jab, knowing that I've recovered from COVID in less than a month's time, and I go for the jab.
Risk is minimal. Remember, the vaccine itself is, it's a complex thing, but basically what it's breaking down at the Johnson & Johnson vaccine is kind of a virus that's been taken in a lab and made sure that this virus can't replicate, which means it can't make more copies of itself. It can't make you sick. It's basically the old Trojan horse. It's basically just carrying something into the body, which tells the body, I have to make this antibodies against this protein. That's kind of in a bit of a layman's nutshell what it does. So the Trojan horse itself is just a carrier. It doesn't cause disease. It's not a live virus. So it's not going to cause anything else. Basically, all that it does, it elicits immune response. And that immune response is going to give you a memory and kind of protect you from getting severe disease. So after having COVID, all we want is just a bit of time for the immune system to recover and then, stimulate it again. But itself, it's not a live virus that's going to make you sick. It's just, you just get a good response against it.
All right. Now, let's go to the issue of pregnant women.
Yes.
How safe would it be for them to administer? And whilst you address that one, breastfeeding mothers and the safety or possible concerns around the child, that is obviously, Of
course. I think valid questions, all very topical. So you must take into context your risk of getting COVID while pregnant. So what are the risks of it having? So we've seen that early on there's risk of miscarriages, and the third trimester, just before you deliver, there are risks, increased risk of having blood clots, especially affecting the placenta. And we found that if there's a blood clot in the placenta, the baby doesn't get enough blood or oxygen, goes into fetal distress, and you need to emergency deliver that baby. So there are significant risks during pregnancy. So you have to weigh up what is the risk of pregnancy of getting COVID and your risk factors, especially if you're diabetic or high blood pressure, because those risk factors put you at risk of severe disease versus the side effects of the vaccine. So obviously in the trials, they don't enroll pregnant women. So we don't have data from the trials, but obviously we've got post-trial data analysis, women that fell pregnant after having the vaccine or were pregnant, they didn't even know they were pregnant, obviously very early, and they had the vaccine. And looking at that, there's been no concerns. The virus, either if you take the Pfizer vaccine or the Johnson & Johnson vaccine, it's not a live virus, so that it poses no threat to the mom or the fetus. It doesn't cause disease. It doesn't have a virus that's going to spread through the body. So there's no problems there. What the College of Obstetrics and Gynecology of South Africa has recommended is wait till at least 14 weeks pregnant, so out of the first trimester. And they recommend it, especially with the risk of getting COVID. So during a wave, for example, where there's high transmission of it, especially if you've got risk factors, your benefits far outweigh the risks. So nowhere has there been any concerns. The good thing about it, if you do get the vaccine in pregnancy, is that your baby is going to get the antibodies through the placenta. So at least for the first 6 months of life, your child will be protected against COVID, which is the highest risk for children. Children don't get severe disease, but if there's going to be a risk, it's going to be those that are less than 6 months or preterm birth. So that's a positive side of it. And there's been no women were allowed to enroll that were breastfeeding and in the trials. And from the trial data, there's been no issues with breastfeeding and the vaccines.
So generally, so simply put, it is safe for pregnant females to take the vaccine.
After 14 weeks, yes.
After 14 weeks. All right. Now, I want to take a question from Kurt Minnar, and he asked the following. Can you ask Doc to speak to us about long COVID and how it works and what it is and what to look out for?
Great, Kurt, thanks. Good question. So long COVID is, a symptom complex that after you've had the COVID, you still have these lingering symptoms. And the most common we encounter, especially if you've got severe disease, about 25% of people with severe disease have long COVID, and that's a big percentage. So that is, they talk about brain fog. You just struggle to concentrate. There's you tired. Fatigue is a big thing. Struggling breathing is a big thing. They've got concentration problems. A friend of mine who's a psychiatrist actually he's seeing young people in their 20s, 30s, and 40s that COVID that are experiencing psychiatric and mental illness. For example, depression, anxiety. So those symptoms prolong. It's an effect of the virus, direct effect of the virus on the neurological system, the brain fog, etc. The fatigue is often a sign of how it's affected the neurological system. Obviously, the breathing difficulties, the lungs that are affected. So those are the long haul things, and those are the things you usually look out for. It's the fatigue, shortness of breath, just brain fog, not concentrating, not feeling yourself, and even depression. And the nice thing about it is we found that looking at data from United Kingdom and Israel, as the people that have actually had COVID and had long COVID symptoms, the vaccines almost terminate those long COVID symptoms. Not in everybody, but in a large proportion, the long COVID symptoms starts disappearing after the vaccine, which is really encouraging because for long COVID, it's really supportive. Yeah. If there's depression, you can treat that, and fatigue, you can advise good sleep patterns and healthy diet and things like that. But for a lot of it, we don't know what much you can do for it. So that's the thing which you also want to prevent. And that's why vaccines are better than getting the disease itself. You've got a risk of getting long COVID, but with a vaccine, you won't, you have the immunity without the symptoms.
All right. Now let's take another question here from Sihle Mgobo. I got mine yesterday. No side effects so far. However, I tested a common theory by placing a coin on the vaccinated side, on the vaccinated area, I suppose. It is magnetic. Please explain scientifically.
Okay. So Sihle, the thing is, it is impossible for a human cell to become magnetized. We can't, to have magnetic properties, you have to change it into a form of a metal. What often happens is you've got skin surface tension, you've got secretions on the skin, there's sweat on the skin, that forms a layer, and there's a kind of a coefficient which allows things to stick to it. So, this theory of magnetism, I know it's been, posted by doctors in the United States, and there's no physiological or plausible mechanism for it, nor is it something that does happen. So you will not become magnetized. You're not going to turn into an X-Men or a mutant if you've got the vaccine. That is purely an effect of skin surface tension, moisture on the skin, secretions on the skin, but just interacting with the metal coin.
All right, and I thank you for that clarification, Doc. And I mean, I thank you, colleagues, for the engagement. I absolutely we welcome this, so that after this conversation, we can, the mantra of the page is educate, empower, and excel. We educate through dialogue, so that with the knowledge that we've gained, we empower ourselves so that we can excel in our respective spaces. I want to take another one here from Abongile Sali, and he says, yes, please. Also, does it affect fertility for males? There's been a lot of rumors.
The vaccine or COVID itself?
What?
I'm going to address both, because I'm not sure. So the vaccine there's been no problem with fertility after the vaccine. Obviously it's early days, so they'll have a look at it. What we have found is reduction in sperm count in patients and men that have had COVID. So COVID itself does seem to affect fertility, whether that is on a basis of disrupted hormonal balances, of fever. There's multiple causes for this. I don't think the true mechanism has been elucidated, but theoretically, this virus can spread to a lot of body tissues via the bloodstream as well if you've got a viremia. But COVID itself does affect fertility. The vaccines itself has been no evidence that it really affects fertility yet.
Okay, so Sally, Mr. Abongile Sally, I hope you're clear there. So the vaccine in itself does not do anything, but if you've contracted it and there may be some, some effect there. Lynette has posted something that I think is interesting. If a person was diagnosed with arterial fibrillation and currently use bisoprolol, yeah, currently, in 2.3, I had COVID last year, November. Any comment there, sir?
So heart disease is so atrial fibrillation is basically just the abnormal rhythm of the heart, where a certain part of the heart doesn't beat properly. So what it does, you've got your blood is relatively slower flowing there, so you could have a risk of blood clots. So that's why they're on warfarin, to keep the blood thin, and the INR of 2.3 is beautiful. That's therapeutic.
Okay.
Having a previous risk of blood clots and being on warfarin is not a contraindication to get the vaccine. And also the vaccine mechanism of forming blood clots is something completely different. That's why it's so rare. It's actually your body has got almost like an immunological reaction to the vaccine and forms antibodies against your blood clotting factor, your platelets that help the blood clot, and then forms blood clots. So it's not the normal mechanism. So even if patients have had previous blood clots before, unless it's on this incredibly rare vaccine-induced mechanism, you can still have the vaccine. There's no risk to it.
All right. And Doc, now tell me, I mean, is my assumption correct that if you've taken the jab, you can still contract COVID-19 afterwards?
Unfortunately, yes. I mean, the virus is still out there. We haven't got rid of the virus. So it's actually an extra layer of protection. So no vaccine currently, prevents the getting COVID 100%. What we do know, the vaccines reduce the risk. It eliminates risk of, getting severe disease, ending up in a hospital and dying from it. Yeah. Almost 100%. Nothing in life and nothing in medicine is 100%. I think the only thing that we're all 100% sure of, one day we will die. But nothing is 100% in medicine. So it's close to 100% that it prevents death and severe disease. But it's only about, between 66 and 70% effective at preventing mild to moderate disease. So yes, you can still get mild to moderate disease. Therefore, we can't quite get rid of the viruses yet, of the mask yet. So the masks, the social distancing, the hand washing, all the non-pharmaceutical interventions, we can't quite get rid of that yet.
Yeah. But now the mask issue, I mean, some people are saying the cloth masks versus the surgical mask versus the N95. Which one is it? Which one is the best one to protect yourself? Because there's just so many theories around the correct mask.
Yeah. So masking is a very interesting topic. One thing that we do know is if we wear something around our face, we touch our nose and our mouth less because it's covered. Because naturally we touch our face quite often subconsciously on a daily basis. And our hands, we don't wash our hands every 5 minutes or so. So if there's something on the hand and we touch our mouth or our nose, we can infect. So a cloth mask kind of prevents that. Cloth mask is not fantastic at preventing, obviously any small particles because it's not made for that. The surgical mask is great for preventing droplets because most of this virus is spread via droplets. So it's small little molecules in the liquid and spit and stuff that you talk and vapor that comes out of your mouth, and that then gets trapped into the mask, the surgical mask, because they are woven in a specific way and they've got an electric charge. The N95 is even better. So that's when the aerosolizing comes up when you cough or when you're really sick, or even when you sing. You get very, very small particles that can bypass through a surgical mask and especially a cloth mask. But N95 mask will prevent that. So for the general population where there's distancing and there's a lot of spread and it's an open area, a normal cloth mask should be fine. But for clinicians working in areas, we go for the N95 mask because it just, prevents that, even those small particles, especially for us working in the ICUs and the wards. The surgical mask should be fine. It's the biggest risk if you're going to be very close to something for a prolonged period of time, that especially if somebody is sick and symptoms, you want the best type of mask, and that will be N95 mask.
A95 is the one, and I'm certain that one is a little bit costlier than the others.
It's about 35 rand a mask.
Well, okay. And can we reuse the N95?
So the thing about mask is a mask should be replaced on a regular basis. The outside of the mask gets contaminated. So if you touch the outside of the mask, that's contaminated. If it gets moisture, it doesn't filter properly. So, after, for us that works in the ICU, sometimes you replace N95 mask 3 times in a shift because it's long days, you sweat, there's vapor in it, because you need a good filtration capacity. And if you're not in those conditions, if you look after your mask, obviously you can use it for longer. But the recommendation is to, the cloth mask is to wash and iron them, on a kind of a daily basis. And I know that doesn't really happen. It's just too labor intensive. But having something is better than nothing in a way. But these masks should be replaced quite often. I've seen people that wear the mask underneath their chin, so the whole thing's contaminated. If you speak to somebody and it's on your neck, and you put the mask here, that whole mask is contaminated. And that should be chucked. There's no point in putting it around your neck and then putting it up again, because you've just literally, if your neck was dirty, you just smear that all onto your mouth and nose, which is even a higher risk.
Yeah, and I think people have over time become COVID fatigue in that they've lowered their guard, and I think the importance of correct usage or wearing of the mask cannot be or overstated. Now I've got a couple of questions here, but I rather want to allow and reserve the remaining time to some of the guys who have asked questions here, and I want to take maybe 2 or 3 questions still. Daniil Kurit is saying, can the doctor please elaborate on the vaccine when taken in the 3rd trimester of the pregnancy? He said it's fine after 14 weeks, but mentioned blood clots as a side effect in your 3rd trimester. Can this be safe?
So, sorry, just in context, is it correct that I said there's clots if you get COVID in the 3rd trimester? So the clots wasn't related to the vaccine. The clots was actually related to if you do get COVID in the 3rd trimester of your pregnancy, then there's a risk of actually having blood clots in placenta. But it is not associated with the vaccine itself. So it's safe after 14 weeks. It doesn't cause blood clots in the trimester. That statement was made that if you do get COVID in the 3rd trimester, you've got a high risk of getting clots from the COVID itself. Therefore, the vaccine is actually protective against that risk.
All right. And then Fatima, she's mentioning quite a lot, but she has, multiple comorbidities, cholesterol, hypertension, and she's allergic to penicillin. She had the J&J vax 10 days ago. There's some side effects. She had cold, chills, tight chest, sore throat, coughing, can still taste, just taking Ventees. Is there still side effects? What do you suggest I do?
Okay, so Fatima, I'm glad you had the J&J vaccine. That's fantastic. 10 days ago, the side effects are usually in the first 2 days, as you said. But you're now 10 days out. So now you've got more symptoms, and you've got chills, a sore throat, coughing. You said that you can taste. So these are unfortunately symptoms that could be a common cold. It could be a flu. It could also be COVID. The taste thing is interesting. With the new Delta variant, it doesn't affect your taste as much as it did as the South African Beta variant. So taste is not an issue anymore. The Delta variant symptoms are literally headache, sore throat, sneezing, and a running nose. It is completely, you cannot distinguish that from a common cold or from normal influenza. So what I would suggest you, out of the first 2 days of side effects, this should not be related to Johnson & Johnson vaccine. This might be COVID or a common cold or influenza. So what I would suggest is go for a COVID test just to exclude that. You're still within the first month of having the vaccine. So you're not fully protected yet, so you can still get COVID. So I would actually advise you, isolate, get a COVID test, and keep on isolating until you get that result.
All right. So Fatima, there you have it. Go for that test if you're able to do so. And then Taryn Smith-Doyle is again, practical advice to protect us with going back now. I think she's referring to us teachers going back on the 19th of July back to our schools. So as children can contract the Delta variant more easily. I think that's a statement and a question combined. She's probably asking,
So that we don't have data yet on the Delta variant in children. So I can't comment on, it's more in children. Our pediatricians hasn't really seen a big uptick now with the Delta variant, although it's only been, a couple of weeks. So the variant itself doesn't change the disease. It's not more severe, and especially not in children or there's no data from that yet. We're finding that your symptoms are less specific. So you have the sore throat, the headache, bit of fever, a running nose and a sore throat. So those are very non-specific symptoms, very similar like the common cold. So how do you protect yourselves? The best advice I can give is get the vaccine. That's probably your best layer of protection. Your second layer is obviously it doesn't prevent COVID entirely, so continue wearing the mask, wear it correctly. Get a good quality mask and make sure it fits properly. I've seen people with masks that hardly fit the face. There's gaps everywhere. It's like I don't know what you are wearing. I don't think what you're thinking. You believe in magic because that mask ain't doing anything. So get a proper fitting mask, replace it properly, wash your hands, keep a distance where you can. Children, at a younger age, probably primary school level transmitted less, there's lower viral loads in those children and they don't, transmit it as much. The high risk is probably for your secondary high school levels, from grade 7 onwards, we find there's high transmission. So keep the distance, do the normal things, stay safe. And I think just, stay healthy, don't do anything that can compromise your immune system, don't smoke, eat a healthy diet, exercise where you can. I think those are the main things you can do. But get the vaccine, that's why it's there for.
But Doc, on the mask issue, there's in some cases it seems to be a fashion statement. Now, I remember right back in the first wave, I bought these nano wave masks and it had these two vents on the side. And now I don't know, so there are divided opinion in the public as to its efficacy. Is it? I mean,
no, the vented ones are not efficacious at all. They don't work. So it's a fashion statement. I've seen animal print. I've seen strange things. It's like close to feathers flocking around the side. Your best is still one of the surgical masks that fit properly. And if it gets dirty or it gets stretched, chuck it and get another one. Those are relatively inexpensive.
All right, we almost drawing the conversation to a close, but Tammy's asking, you mentioned that on the issue of fertility in women, or in men rather. So what's the effect of COVID on fertility in women if they've contracted it?
We haven't seen a lot of data coming for fertility in women. We know that it can affect your sperm quality, but I think the reasons for that is still, there's many things, from medicine, people taking the fever that you've had, etc. So there's not a lot of data yet on fertility in women. We're hoping that it doesn't affect that much. I think there are still papers that are being reviewed. A lot of data is coming through. It's a massive amount of data coming through on a daily basis. But those things are interesting, but it has to be submitted to the right authorities and it has to be peer reviewed. It means basically people are the specialists that know what they're talking about, read through it and say, look at the way the studies have done and see if it's proper or not. So there's preprint things that say that it might affect fertility, but we've got no clear data on women at this stage.
Yeah. And just somebody asked earlier about diabetes and how it affects a person with diabetes. I think you've covered that, but
so your biggest risk factors, and I think that's one thing that people haven't really addressed is the effect of certain conditions, comorbidities on the severity of COVID. So what we're seeing in hospital, obesity and diabetes are, especially poorly controlled diabetes, is bad news because often these people come with severe COVID. And I've seen, predominantly the deaths in South Africa has been above 65. But we've seen a lot of cases in the 30s and 40s with very little side effects, very little comorbidities, sometimes a bit of diabetes, but obesity is a massive thing. So what I really want to emphasize to people, we should be focusing on is on our diet and our weight. Obesity is a big thing in South Africa. Up to 30% of adults are obese in this country. So just looking at your diet and losing weight will be a main thing. Diabetes, get well controlled. You want to be at your target for your HbA1c. For those that are diabetic that know, when you wake up in the morning, your fasting sugar should be between 5 and 7, 5 and 8, depending how old you are. So get at that target, because unfortunately, being diabetic and obese are risk factors for developing severe COVID.
Okay. And I think you've covered this question on if it can trigger diabetes.
Yeah, there have been reports where it's been triggered. It's on an immunological basis where basically the virus or the immune response to the virus, both of them can actually affect the cells that produce insulin in the pancreas, the beta cells. And we've had cases of people developing diabetes after COVID, yes. It's not very common, but we do see it.
Yeah. Doc, as we draw this conversation to a close, can we possibly expect more waves? I mean, we're currently in the third wave. Can we expect a fourth, a fifth wave? There's also the different variants. I've heard of Lambda and just your views on that.
Yeah. There's a list of the whole Greek alphabet of variants out there currently. Luckily, Lambda is not in South Africa yet. But unfortunately, yes. Coronaviruses mutate. All respiratory viruses that you get, your flu virus, your common cold, that's why we keep on getting cold and flus, because the virus keeps on changing. So these viruses mutate. That's what a virus does. It wants to survive. It wants to live, man. And so this virus will keep on changing to make it extend its lifespan. So yes, theoretically, we're going to keep on getting waves. The only way out of this is to get a lot of people vaccinated as possible, because if you're kind of the susceptible population is small, because you need people that are susceptible to get the virus and for it to spread between people. If you've got antibodies, it reduces that. And we've also found from the studies that if you've had the vaccine, if you do get COVID, the amount of virus is much less. So the viral load, what we call it, is less. So your chance of transmitting it by definition then should also be less. So unfortunately, because these things mutate and because people travel, you can choose to lock down your country like New Zealand. I think they're only opening up for foreigners in 2024 again.
Wow.
You either lock down, permanently to protect it and get everybody vaccinated, or you kind of just vaccinate your population, So unfortunately, as these coronaviruses do, they do mutate. We can expect more waves. I don't think we're out of it. At the current rate of vaccination, we're probably only going to get there by the end of next year. And that also just depends on the variants. One thing that is coming up now is if the variants become significantly different, they will evade the vaccine. And even if you had COVID before, you'll be susceptible to getting it again because the virus has changed enough. So what we suspect will happen in future, and they're working on that already, is to get to work on boosters. So you get another vaccine, which is like an annual flu vaccine. You get a flu vaccine every year. Kind of the same thing with this. They just tweak it every time to cover these variants.
Sure. And can I take a flu shot after my COVID vax?
Absolutely. We do recommend it. Just give a 2-week break. So it gives your immune system enough time to kind of prime again and to focus on a new kind of vaccine given. So as long as it's 2 weeks, absolutely, and go and get the flu vaccine.
Okay, so that's the one. All right, Doc, this is all we had time for tonight. Time flies when we have fun. I mean, just some final thoughts on for those of us who are still sitting in our corners, concerned and hesitant as to whether I should take the jab or not.
Yeah, so I want to say, having a new drug or something injected in your body can be very scary for people, especially if you don't know. I think with the vaccines across, it started with the smallpox vaccine in the beginning of the 19th century. People have been hesitant to that. Obviously, people said, no, but there's no long-term data. Well, long-term data takes about 10 years to get. No vaccine ever in history has had long-term data when it was started. So that's not really a valid argument from that sake for a disease that can affect you. If you don't get severe disease, you can still get long COVID from it, which can be debilitating for people. I think, as data comes across, the trials shows great safety. Yes, there will be some side effects, but for my thing is like the only way now to protect you is to get the vaccine. I think there's robust data there's great real world data that it works, prevents severe disease and death, and that's what we want. There's been, isolated side effects, the common things are a bit of a sore arm, that's fine. But the severe side effect is rare. Obviously,
Yeah.
the spotlight is on this. New things will come up. But I think, if you've got questions, go to a reputable source to find out the answer. I've seen so many people have these strange YouTube videos from people without any credentials posting stuff which is opinion based, or
Yeah.
even some of these are actually funded by anti-vaccine campaigns, so which is just people like actors saying things that's scripted. It's just be careful what you watch. It's like when you study for an exam, you're going to make sure you've got the right textbook, the right material. It's no point, you get it from a buddy who says, I've heard this and I've got a feeling about this, or I've seen this YouTube video and this is what they say. It's not, make sure you get your facts straight. But please ask questions. Critical thinking is amazing. That's what we're teaching and that's what we want. But paranoia and just plain criticism out of fear doesn't move you any further. So ask the right questions and, get the right sources. There's a lot of stuff available from university sites, from the CDC in America and things like that. So educate yourselves and don't be unnecessarily afraid. All of us doctors got it, and so most of us got it, 500,000 of us. We're still alive and kicking. None of us have grown extra limbs or anything strange. There's a lot of things that's gone there. It's not going to magnetize you. It's just this extra layer of protection that kind of gets us back to normal living as soon as possible.
Well, there you have it from the expert himself, Dr. Greyling from NETCARE. I almost said Kilsriver, NETCARE Christiaan Barnard. Now, Doc, thank you very much for sharing your expertise and your time here tonight. I'm sure that we are enriched, and I'm hoping that in future we are able to count on your insightful expertise once again, should the need arise. And so, from us to you guys at the hospitals, I wish you nothing but success and strength as you continue to save lives and to keep our nation safe. It's in Afrikaans there's a saying, it's a ewigheidswerk, and so we want to, if we can partner in a manner like this to bring about, to inform and to advocate, then I think this is a step in the right direction. So I trust that you will have a safe and blessed journey ahead.
Thank you so much. And Lee, thank you so much for creating this platform. I think it's amazing. And if you ever need me again, I'm more than willing to help out again.
Well, I'm going to count on that one. So, ladies and gentlemen, thank you very much. That's all we have time for tonight. I'm going to play us out with an appreciation insert for our essential workers, especially our medical staff. So thank you for joining tonight. I'm sure that there are still many questions. We can probably field that at a later stage, but thank you for tuning in. Stay safe and God bless.